So Rob Luisana graduated from East Carolina University in 1973, where he was student body president. He's a former Guilford County teacher and basketball coach, as well as serving as president of NCAE for Guilford County Schools. You have to tell us what that is, Rob.
If I can remember, North Carolina Association of Educators.
He has worked as a health insurance broker and consultant for the past 35 years, working with corporations and individuals on all aspects of healthcare and insurance. Over the past 5 years, he has been a frequent presenter on healthcare issues, including NPR and Politico.
I've got slides, but it's more important to me. I do this because I want to have a conversation. So it's more important to me to hear what you think, what you have to say, than it is for me to get through the slides. So stop me. If you have a question, you want to say, Rob, that doesn't make any sense, stop me. I'm going to get as far as I can. I'd like to have a conversation. It has become more and more difficult to have a conversation about something like healthcare because, sadly, we've become more divided, and this is, it shouldn't be, but it's a divisive issue because it's become political. But I do want to talk about it, and I mainly want to hear your thoughts and your questions. And I'll start by telling you one more story before I get into the actual presentation. I have 4 grandchildren. My oldest son lives in Raleigh, and about 3 months ago I called him, and he said, Mason, who's 8, his son, my grandson, is home with the flu. So I had this wave of sympathy, and I said, Ryan, put Mason on the phone, let me cheer him up. And I got Mason on the phone, and I said, Mason, hang in there. In 2 or 3 days, you're going to start to feel better. And he didn't say anything for 5, 6, 7 seconds, and then he responds and says, is this your idea of good news? That's probably the same thought that most Americans have when we start talking about healthcare and healthcare reform. And I'm going to put everybody on the spot now. I'm going to ask a question that's kind of become the focus of the debate on healthcare, and that is healthcare a right by virtue of being a citizen, or is it a product that's sold based on where you work or the state of your health or cost? So you don't have to respond to this if you don't want it. If you think healthcare is a product, though, and you want to respond, put your hand up. If you feel like healthcare is a basic right, put your hand up. Okay, pretty even division. And I'm also going to tell you something you may not know. We have universal health care. Does anybody realize that? We have a federal law that requires hospitals to admit, stabilize, and treat anybody who walks in the door. Unfortunately, it's the most inefficient and expensive system anyone could possibly design. And I'm going to pause here and take a breath. Anybody want to hit me with a question? Dale?
Does this have anything to do with how our responsibility in terms of taking care of ourselves versus how they take care of themselves?
Yes, that's a great question. Responsibility. So let's talk about that. Let me answer this one, then I'll get Johnny. Yes, there are other factors involved here. Wellness, other things are involved. But I'm going to kind of divert here. 150 years ago, we faced another dilemma in education. And that dilemma was, should we be providing education to every student between 1 and 12, between grades 1 and 12? And there were a lot of objections to that, because 1 is going to raise taxes. 2, there was an argument about responsibility. A lot of these kids are from poor parents. They don't care about reading, writing. Should we be providing education to everybody? But our states and the country made a decision back then that we would, in fact, fund public education for every citizen. There was no responsibility test. And had there been a responsibility test in high school, and some of you are starting to smile when I say that, many of you probably were like me, I would have been jerked out of school in high school if there was a responsibility test. So I would say when it comes to health care, I don't even know how we begin to apply a responsibility test. Do we go around and say, are you no more than 20 pounds overweight? Do you smoke? Do you smoke a pipe? Do you smoke a cigar? Do you go to all your primary care, preventive care exams? I think when it comes to things like education and health care, we have to assume there's going to be some people that are irresponsible. But I think having health care for everyone is the right thing to do.